Thank you both for being here.
Thank you.
Thank you.
To some board business, you will have received minutes attached to which are a number of documents, including the one to which Senator Hernandez referred in his testimony this morning. I assume we've had an opportunity to review minutes and would quite happily entertain a motion as to their disposition.
I move to approve the minutes.
Commissioner Westendorf, thank you. Is there a second?
Second.
Thank you, Senator Johnson. Any discussion? All those in favor say aye.
Aye.
Any opposed? Same sign. Here's my agenda. So some board, other board business. There it is. We've just been reminded we'll be in Canyon City in June. Is that right, Ms. Klein?
Correct.
Look for communication from Ms. Klein as to logistics and details, and I'm sure they're working hard now to give us a good view of human services in and around that part of Colorado. And then in July, 2 days after July 4th, celebrating American Independence Day, we'll be back here at the department in Denver. Any questions? Any other details, Ms. Klein, you want to share out at this point?
At this point.
At this point. Senator
Thanks,
Johnson.
Mr. Chairman. So is there a location for the Fremont County meeting
Ms. Klein?
at this point?
We do have a location. I can give you the address in just a moment if you'd like that.
Well, it might be good for the record just to have it.
Sure.
It's been noticed,
It
right?
has been noticed. So
Okay.
it is on it. As far as, actually, give me a second here. It is at 201 North 6th Street in KC.
And I assume, Ms. Klein, there'll be some Thursday afternoon
They are.
touring, and
They're still working on the agenda, but they are very excited to have us. So I'm sure it'll be very thorough,
that's great.
detailed agenda.
That's great. So if you have questions, do be in touch with Ms. Klein. Commissioner Davidson, are you still on the phone?
I'm here.
Outstanding. Just where we want you.
I don't want to forget that you're here. Okay. Any other board business at this point? Commissioner Johnson, would you read the opening script, please?
I move that all emergency rules which are adopted include a finding that their immediate adoption is imperatively necessary to comply with state or federal law or federal regulations, or for the preservation of public health, safety, or welfare, and that compliance with the notice and hearing provisions would be contrary to the public interest.
Is there a second?
Second, Jeff.
Thank you, Dr. Kaur. All those in favor say aye.
Aye.
Any opposed, same sign.
Aye.
That was a lit.
I'm assuming that was in support of the motion and a little tardy.
Aye.
Excellent. So let me move document number 1, then, which is revisions, Adult Protective Services Program revisions to be brought to the table for input and discussion on initial read, with the understanding that comments may not be adopted at this time, but may be taken into consideration on final adoption at a subsequent meeting as formally noticed. Mr. Wester?
Good morning.
Bring your team and introduce yourselves for the record and walk us carefully through document number 1.
Good morning. My name is Mark Wester, and I'm director of the Office of Community Access and Independence, in which Adult Protective Services is housed here at CDHS.
Good morning. I'm Mindy Kemp. I'm the director of the Division of Aging and Adult Services here at CDHS.
Good morning to you both.
I'd like to begin by thanking you for your attention and the work session that we did last month where we reviewed APS 101. I really felt like that it was great to have an opportunity to describe and really engage with all of you on exactly how the APS program works in the counties, but also how we as a state department interface with the counties to make it a successful program. We hope that it provided a framework for how APS works, and it will give you more context to our discussion about the rule packet today. Document 1 today is the last of 3 rule packets to implement House Bill 17-1284, the CAPS background check bill. The final packet primarily addresses the process that employers will follow to request a CAPS check beginning in January 1, 2019. And I might remind you that the implementation of House Bill 17-1284 is really to develop a process by which caregivers that are found to be substantiated for abuse or neglect are tracked, and there is a formal way that we can highlight that. Moving forward, before we get into the details of the rule packet, which Mindy will be covering, I'd like to provide you with an overview of how we have engaged stakeholders over the past year as we developed this particular rule packet. And Mindy is passing around a list of our engagement with stakeholders. And first of all, we have engaged county departments of human services, and it's important for them to have input into the rulemaking process. The department, in collaboration with Aps Task Group, that is part of the PAC structure. So one of the things that, let me go back and say, first of all, there was an APS task group that was established to develop the rules. And the APS task group is made up of caseworkers, supervisors, and other county APS staff who actually do the work. And at this APS task group, they formulated the rule packet 3 here, or document 1, and then throughout the process, once they had the initial draft, they move it on to the adult and aging subpack, which is also made up of supervisors, county directors, and that process, the rule packet is reviewed and voted on in the subpack. And then on up the chain, it goes to the Policy Advisory Committee, which involves office directors across the department, as well as DHS supervisors and directors from across the state. And the rule packet is voted on again at that point. I wanted to highlight that so that you would have an understanding of how the people that actually do the work out in the counties were integrally involved in developing this current rule packet. These proposed rule changes have been, as I have noted, have been reviewed and approved by the Aging Subpack and the PAC at large. In addition to that, because this involves employers, that stakeholder engagement has been important to us as well. And we understand as a state department and as an office and as a program that we're implementing something that's complex, that has not been done yet formally, and so we wanted to go into this with our ears wide open, with humility in hearing from stakeholders, employers, advocacy groups, and as such, so that we get this right. And so We understood that, and we have anticipated that there would be many groups and employers that would have some things to say about this work. So we've engaged in a broad range of stakeholders over the last 6 to 8 months. We've had stakeholder meetings, 4 meetings with stakeholders specifically on this rule packet. In October, we provided an overview of the plan for the development of this rule packet prior to drafting it, soliciting feedback on any areas for concern or questions to be addressed. In January and February, we shared an initial draft of these rules for feedback. The engagement was so robust that we ended up holding 2 more sessions to be sure that we were able to capture all the feedback and that we heard all of the issues and considered them fully. In March, we shared a final draft with these proposed rules to seek any final comments and feedback. We've also had one-on-one discussions and phone calls with several stakeholders. Over the past 6 months, we have met with several stakeholders individually to discuss their questions and concerns, including representatives from Alliance, the Colorado Hospital Association, the Home Care Association, as well as others. We've also invited and received in writing emails from stakeholders, and we encouraged them to provide us any questions or concerns via email, and we have received a few of those with questions and concerns. We really appreciate the time that many stakeholders, all the stakeholders that have participated, have taken to engage with us in this process. As I said, we want to get it right. And we feel like that there has been an open exchange and dialogue, and there continues to be even in this process. Their input has been very helpful as we finalize the rules we are bringing forward to you today. We have thoughtfully considered the feedback provided by stakeholders over the last 6 months in developing the final drafts of this rule packet. In some cases, we've updated and changed the draft version and made in response to those questions and concerns. In other cases, we did not. And you'll hear about that. Actually, Mindy is going to go into, and we're happy to illustrate exactly where the tension points are within this rule packet 3 or document 1. And I'm sure in addition to that, we have invited where those tension points are. We invited the stakeholders to be here today so that they could speak directly to you about that. Also the feedback, all feedback that we have received is included in the stakeholder comment summary section of the rule packet on pages 9 through 11. Finally, in the interest of true engagement and transparency, we sent the final version of this rule packet to stakeholders that we were aware might be interested in, to encourage them to share any thoughts that they have with you about the rule packet directly today. At this time, I'd like to turn it over to Mindy, and she's going to walk you through the details of this rule packet, including the tension points that I mentioned earlier.
Ms. Weston? Ms. Kim?
So at this time, I'd like to turn directly to rule page 1 in your packet so we can walk through the proposed changes. And what I'd like to do is just go section by section. And as Mark mentioned, we'll highlight any feedback that we've received, decisions we've made to propose certain rules to you today. It's also important to note that some of the language in these proposed rules mirrors exactly what is in statute. And so we actually have available for you today, if you're interested, a hard copy, or Beth can pull up on the screen as we get to those sections, House Bill 171284, just to show you why certain language is the way it is and kind of match it up so you can see why we chose that specific language to propose. So we're going to start at section 3100, which is the definition section. And there are 3 new definitions that we're proposing to be included in rule. So on page 2, jumping right in, the definition of direct care has been added. And we've added this to be consistent with the statutory definition. And this was actually made to address a request from employers during our stakeholder meetings that said, you know, would you please include the definition in the rule? So it's not just in statute, but it's in rule. So that definition is on page 2. We did receive some feedback from stakeholders you might have noticed in the comment section to request that we further define that. However, we went back and looked at that and realized that you can't really further define something that's in statute. That would essentially be limiting sort of what direct care is. And so we wanted to make sure that we were mirroring the definition.
I'll take advantage of your pause, Ms. Kemp. Was there a particular recommendation around a further enhancement to the definition?
So we didn't, thank you, Mr. Chair. We did not get a very specific, we would like this instead. But one of the concerns was that, you know, there's confusion or question around whether somebody like a maintenance staff at a nursing home would be considered direct care. And so what we've recommended to employers is that, you know, as a group or as an individual organization, you can certainly identify policies. You know, it is our policy that people under this classification or title at our agency are not considered direct care, and here's why. And so that's where they can limit it. But we also didn't want to limit it if you, for some reason, had a maintenance person that did do direct care as well, under, you know, actual caring for people type of a situation. We didn't want to say, you know, except for maintenance people, for example.
Thank you.
There are no further questions. Moving on, the other 2 definitions are also directly from statute. On page 2, they're employee and employer. And so we wanted to add these because we do reference them quite frequently later on in the rules, so just to have them in the rules.
Director Bika.
Thank you, Mr. Chair. Would an intern or that type of person fall under an employee or a volunteer for this purpose?
Ms. Kemp?
That's a good question, Director Bika.
Okay,
I
well,
don't think we considered that.
let's just, like, this is first reading, right, Mr. Chair?
It is.
Yeah. Why don't we just make a note of that and consider it?
And I guess I'm going to take advantage of Director Bika's question and ask the department as well to contemplate, and I'm not sure what the right answer here is, and I do trust stakeholder input as folks who are in the trenches. But you used maintenance worker, and it got me to thinking. So if a maintenance worker is in an environment in which a person is receiving supports and services, that maintenance worker isn't him or herself providing those services and supports, but still has access to the very person that this is contemplating to sort of protect.
Right.
And so I maybe I'm just stuck on maintenance worker, I don't know, but I would ask, I suppose, that you contemplate the potential risks of including people who are in the environment but who aren't directly providing a support or a service as potentially somebody that we ought to be, I don't know, worried about or thinking about or something. Director Bika.
I think, and I'm sure we'll get into this, but what you just defined, Mr. Chair, would be the difference between direct care and an employee. So there would still be requirements in this rule package and under the statutes for somebody who's in the category you just talked about, but doesn't rise to the level of being in a direct care role.
Okay.
So we may want to, as a board, go through, or you all may want to, as a board, and make certain that we're getting the right category in the right place.
Ms. Kemp, does Director Bika sound about right?
There is a distinction
It's a
between.
loaded question, by the way, Ms. Kemp.
One in which she did not start her answer with yes.
Yeah.
Thank you, Mr. Chair. Yes, Director is on the right track, that there is a distinction between direct care. When we get into the requirement section later that also mirrors statute, the requirement is essentially for these employers to conduct a check on direct care employees. So it doesn't say all employees. So the direct care definition is fairly significant in terms of what this means. And I would actually looking at Mr. McCombs for further assistance on the direct care definition in terms of whether we could expand that beyond what was included.
Well, Mr. McCombs, before I turn to you, and I'm happy to do that, I'm not sure that we need to litigate it here. I would just ask that the department take note that if the CAPS check is contemplated for direct care employees, it would, by definition, therefore exclude some number of humans who might have access to the people that this is contemplating protecting. So I would just ask that you all walk through that language a little carefully. Mr. Combs, I didn't mean to cut off any commentary, but.
Sure, it's a useful principle though, to just, because I'm sure this will come up again and again when we run into statutory language that we feel could use a little more. The board has the power to define in rule or apply the definition to specific circumstances. So a rule could interpret the statutory definition and say, this does not refer to an intern, or direct care does not include maintenance staff. The risk is that in applying that definition, we actually end up being contrary to statute. And it's one of those death by 1,000 cuts things where we get further and further each time we apply. So one thing that agencies do is in rulemaking, which is quite sound, is to adopt the statutory language first, with the benefit of experience, understanding what are the most common interpretive questions that arise in applying this. Then there's further development in specific cases. So that's one option available.
Thank you. Commissioner Westendorf?
I think your line of questions does two things. I mean, first of all, it's the statute that we're obligated to design rules for, but also practicality. I think it's important to also really be conscientious about what is the objective of the rule within the statute, and maybe if there's room for enhancement, so to speak, what's the real objective of the rule? Because you can get on a slippery slope and all of a sudden be talking about something that wasn't part of the rule. And lastly, we're talking about just the last conversation we had prior to this meeting was the cumulative impact of additional rules. And if you start saying, well, this person might have access to a person who's at risk, so they're going to have to get a background, and you just added another $75 to that, to what it takes to operate your business. And you're also screening out people who might be perfectly safe to do that job, but you have a smaller pool of applicants. So just one of those things that I think I hear a lot of comments about, well, we need to err on the side of caution, and I think the cumulative effect of that can be paralyzing. So that's more philosophical.
Thank you. Ms. Tai Chim.
I think if the objective is to protect the individual, though, anyone who has access to that individual would mean, right, that to me, instead of direct service, it's who has the access to that person who they can be alone with, or so that, I know it's costly, but that's kind of what I think about is that's the objective, is who has access to that person and who could do anything.
Okay. Further comments or questions? Ms. Kim?
Thank you, Mr. Chair. We are going to turn all the way to page 5. And we do have one change proposed on this. It's number 11 on the top, which is adding the exceptions to the confidentiality requirements. The disclosure is provided basically as part of a CAPS check. And just to clarify, the State Department, which is CDHS, is the one that's going to be conducting the CAPS checks. And so this essentially allows us as the State Department, when an employer requests a check, to provide some very basic information that's outlined later in the rule packet on, yes, this person was substantiated on this date in this county for this type of mistreatment. So without this, this is also directly from statute. It was added during House Bill 1284 last year. Seeing no questions, we'll keep moving along. We are now moving, let's see, to the next page, page 6. There's a large section that was added to rule under background check requirements. This is the section in the APS. I know you don't have a lot of context for where this falls in the APS rules, but this is the section specifically related to how county departments, what their requirements for APS caseworkers and their other APS staff related to background checks. Previously, it had information here on how county departments need to conduct criminal background checks. And so this is the addition of requirements for county departments on how they need to conduct CAPS checks starting January 1st. So the changes are A through C. And essentially what this does is it creates 2 ways in which county departments can request a CAPS check or conduct a CAPS check. The bill specifically called out county departments because they have a unique situation in that they have caseworkers and supervisors that have access to the APS database. So one of the things we heard from county departments was, would it be possible for us to conduct our own checks? And so that was actually written into statute, a specific allowance for them to do that. But what we've proposed here in rule is 2 methods. They could either have their county supervisor, under number 1, conduct the search directly in CAPS for when their county is hiring a new or existing APS staff person. And in that case, they would still need to exclude findings that we'll talk about in a later section, similar to the employers. And they also need to attest in CAPS that they've completed the check. The other method is that they, if they choose not to have their APS supervisor conduct that check, if they don't feel comfortable with that, they'd rather have their HR department, for example, conduct the check. HR department staff at counties do not have direct access to the CAPS database because of the confidentiality reasons. And so they would actually be able to go online, register like employers will, which we'll talk later today. And they can use that method for conducting a check just like the other employers will. And then B and C, just to get through these and open it up for comment after that, is, B talks about that the information received through a CAPS check is to inform their employment decision. And then information obtained through the CAPS check shall only be released pursuant to the section that talks about confidentiality.
Questions? Director Bika.
Thank you. Is there a place that requires the county or later the employer to keep a record of the check?
Ms. Kemp.
Thank you, Mr. Chair. So we had initially drafted that into the rule for employers, all employers, and employers said that, shared feedback with us that it was basically their prerogative whether or not to check it. And we really, under CDHS, are not sort of regulating nursing homes and other facilities. So we did not include a requirement for employers to maintain a copy. I will say for CDHS's oversight of APS programs, we will definitely request that county departments maintain that so that we can do some quality assurance and checking on that as the specific regulatory agency over APS staff.
Director Bika, follow up.
So the county would be required to keep a copy of that check, particularly if they did method 1.
Ms. Kemp.
Thank you, Mr. Chair. So we don't have anything specific in rule, but they would want to have some sort of copy to show us, if we were to be doing an audit or something like that.
I might suggest that you add that in rule 2 just to be abundantly clear. If you're going to do method 1 in particular, but I would say both of them, you should have a copy of that in the personnel file or something so we can go back and check. I would also, I'm curious, I don't see that requirement for the criminal background check or the fingerprint check either. And it seems like keeping those records handy would be of value to verify that counties, and I would argue employers, are following the law.
Clarifying.
Ms. Tayachana.
Are you saying the county should keep that, but not the employer is at will whether they should or not? Is that the conversation we're having?
Ms. Kemp?
Thank you, Mr. Chair. I think what Director Bika is suggesting is that for this specific session that we add something to state that the county needs to keep a copy of the record that they've conducted the check. And I just pointed out that later on in the employer section, we talk about all the employers, nursing homes, hospitals,
Right.
et cetera, that we have not included language, mostly because we don't regulate them.
Right. Okay.
Ms. Kemp, a question. You will get into cost, which is a fair chunk of interest. If a county pursuant to this section, and particularly A1, searches CAPS on its own, is it held to the same costs that would be imposed on the county if instead it used the state and private employers who must use the state?
Thank you, Mr. Chair. So if they use method 1 and conducted the search themselves, they would not have any fee. And if they use method 2, they would have a fee. And to further on that, we've done some analysis of the number of APS caseworkers in the state that are hired each year. It doesn't appear to be a significant impact to counties if they used method 2.
Those are famous last words, Ms. Kemp. I tend to get worried, just generally speaking, about the unintended consequence of creating uneven playing fields. I certainly am not interested to Commissioner Westendorf's earlier commentary in driving cost. On the other hand, all of us who work in human services are competing in essence for talent, and costs of bringing talent that are uneven across different organizations can create significant challenges. And so I suppose I would ask that some consideration be given to whether, I mean, if it's up to me, we give employers access to the database. They can ping that database. I'm way ahead of the program here, I apologize. And the costs are around preserving the database rather than imposing costs on employers who are struggling to make ends meet as it is anyway. So something for you all to think about, please. Director Bika.
Thank you, Mr. Chair. And I want the board to know that the department has contemplated that issue. It would require a statutory change to allow non-county or state employees, non-county or state persons access to the database, number one. Number two, there would be a substantial cost to the state to change the database in order to manage the confidentiality requirements. And so the department, while we appreciate and we have heard from lots of employers, can't we just go check ourselves? That's not really a board or department decision. It really would require a statute change and legislative investment to change the system to allow that to happen.
Thank you, Mr. Chair. If there are no further comments on this section, we will move on. We're skipping ahead all the way to page 8, I believe. And as you'll notice, is this right? No, I think we're on 8. So this whole section, .960 is new. And so we will walk through each of these items and address, again, concerns that stakeholders have made so you know why we're proposing what we are. We wanted to clear up front, again, that I mentioned before, is that the department is going to be the agency responsible for conducting the CAPS checks. So just to clarify, the counties will not be doing that function. It will be centralized here at CDHS. So starting with A, this language again is taken directly from the statute. It's section 111.7 is the list of employers that beginning January 1st will be required to conduct the checks. So you'll see a variety of different types of organizations on there, including health facilities, adult daycare, and so on. And so this letter A is basically just identifying those organizations that will be required to do the checks per the statute. And then moving on to B, the statute also allows people who are receiving consumer-directed attendant support services, or CDOS, that they may request a CAPS check for a new or existing employee. So letter A is those employers that will be required per the statute, and then CDOS participants are, they may request a check, but they're not required to. Moving on.
Ms. Rule?
Yes.
Excuse me, Ms. Kemp. Ms. Rule.
Thank you, Mr. Chair. I'm sorry, for someone who doesn't operate in this environment, can you explain CDOS? What is that?
Ms. Kemp.
Thank you, Mr. Chair. CDOS is the Consumer Directed Attendant Support Services. It's a program operated through the Department of Healthcare Policy and Finance, and essentially allows an individual to self-select people to provide services to them and essentially work directly with that person and pay that person and that sort of thing. So it's a little different model than having, services go through a specific agency, but allows sort of more choice and opportunity, for example, for somebody to work with someone that they already know to help support them.
Ms. Kemp, if I can follow up, I should know much more than I do, and I apologize in advance for this stupid question. In CDOS in Colorado, are there scenarios in which a person is using an EOR as the employer of the direct contact or direct support worker? I'm sorry, employee of record or employer of record, my apologies. Ms. Kemp?
Thank you, Mr. Chair. I'm not as familiar with that program, and so I'm not able to answer that question, but we can look into that.
Thank you. I appreciate your...
No, I think that's the best.
Mr. Wester?
Thank you, Mr. Chair. Yeah, absolutely. We will check on that detail relative to CDOS.
Thank you. I appreciate it. I know that CDOS right now, please God, we should hurry up with a second option for Coloradans, but CDOS right now is available through the Elderly, Blind, and Disabled waiver. That is administered by single entry points. And it occurs to me that this is an increasingly popular, and I think justifiably so, option for people and families. And I'm no more interested in passing along additional costs to people and families who are likely to be the least able to afford it than I am adding cost to deliver services generally, on the one hand. On the other hand, as this option grows and as we see the advent of consumer-directed attendant services and supports coming into the supported living services waiver, it will more than, well, I don't know, it's likely to double-ish the number of people who are taking advantage of that. And I just want to make sure that they are enjoying the same set of protections that this envisions offering to people not in that option.
Absolutely, Mr. Chair. And this was a particular concern with, as we met with stakeholders, families and guardians. They raised this issue in particular, so we will look at it and bring that back in our second reading.
Thank you. Ms. Kemp?
Thank you, Mr. Chair. Moving on to C. Basically what this section does, it details that the CAP checks results are confidential and can only be used for the purposes of employment. and can't be released for other purposes. Again, this, as you'll see in the references to statute in here, this is the information directly from statute. Are there any questions on that one?
Mr. Busher.
Thank you. I realize that this mirrors the statute, but I'm a little bothered by putting what looks like a criminal violation in rule.
You can't do anything about it.
Something we don't normally do.
Just ask the department to take careful note of it. Mr. McCombs, do you want to comment?
Yeah, this is something that occurs in a number of our rules around confidentiality provisions, and there's basically two ways of looking at it. Mr. Busher is absolutely correct that the department does not have rulemaking authority to promulgate a new criminal penalty. On the other hand, some of the feedback that we've had from stakeholders is rules should collect everything into one place, so it's a one-stop reference. So I can certainly get behind including or just reflecting that there is a criminal penalty for confidentiality violations in the rule. Maybe there's a way to massage it so it doesn't look like we're establishing a new criminal penalty, but simply informing people of the existing one.
Mr. Busher.
And I would be much more comfortable with something that said the disclosure may violate such and such a statute, rather than saying the person commits a crime.
Right. We can work together on that.
Great. Thank you, Mr. Busher. Ms. Kemp.
Thank you, Mr. Chair. D talks about that this requires the employer to register with the CAPS check unit, what we're calling the unit is CDHS, that will be conducting those checks, so that we can verify that the employer is statutorily allowed to request a check. The statute is pretty specific in who should be conducting these checks, and so this section basically requires them to go online and fill out some basic information. It will not be an extensive process. It will just be like a one-page form online where they submit their employer information so that we have a record of them. And if necessary, we can check with our other state agency partners to ensure that they are, in fact, an agency required by statute to conduct the check.
Ms. Rule.
Thank you, Mr. Chair. I mean, isn't that just going to Secretary of State? I mean, are you looking at other criteria by which they would be, I'm sorry, where is let me ask a different question. What is the source agency that you would look at that would qualify them?
Ms. Kemp.
Thank you, Mr. Chair. So for example, under A1, it talks about health facilities licensed pursuant to. So those are specific health facilities monitored or regulated by the Department Public Health and Environment.
Yeah.
And so we would work with our partners at CDPHE to ensure that the facility is licensed under their agency.
Other questions? Ms. Kemp, take a look at, with Mr. McCombs, not now, but on your continued work, at the use of the word screening. I only offer it. It's altogether possible that this is ridiculously picayune. On the other hand, screening may have meaning in other sections that define, not other sections of DHS rule, though that's altogether possible as well, but providers are subjected to quite a number of background checks, investigations, screenings. We use these words interchangeably, which always gives me pause. So we just ask that you take a look to make sure that the use of the word screening there is appropriate and shouldn't say check, in fact, since we're talking about checks. Ms. Kemp.
Thank you, Mr. Chair. We are moving on to E. However, I did want to point out in D, there are two sub-bullets. that the employer is responsible for making sure the registration information is up to date and that there is no fee. We did add number 2 in response to stakeholder feedback. They had questions. It wasn't clear in our initial draft that if there would be actually a fee to register. And so they requested that we include in here that there will not be a fee for that specific purpose. And E talks about that using a form developed by us at the state, the employers need to obtain written authorization from the individuals they are requesting the check for, and also provide us with any required identifying information such as their name, their date of birth, and so on. And that, again, the intent of written authorization is in the statute. And so this just further clarifies that they would be providing us that information.
I appear to be the only curious one this morning, Ms. Kemp. Again, just ask that the department with the AG contemplate language in that form, particularly around claims of liability that could arise from the employer's use of information that we do not have custody over. So we get a hit on the registry, and it's deemed, it's given some severity level. You've allowed employers to make decisions independently of what resides on the rep accounts. You're compelling employers and counties, I presume, to use a form that you're developing. And I wonder if there isn't an opportunity for the department to include language that sort of relieves private employers, if not counties, although I don't know how that works, from any, or protects against any claims of liability for using information that is in fact in error from the CAPS registry. Just ask you to take it under advisement. Director Bika.
Well, I'm not sure what the department could do in that circumstance. So if we, in full faith, gave information that we believe to be accurate to an employer, and the employer used that information that was inaccurate, and you're concerned that there could be liability to the employer, I think is your question. I don't know that the department could do anything without the legislature changing law to create some immunity, I would think, from the employer or the state. I mean, Ted can certainly kick me under the table if I'm wrong, but I don't think the department would have any authority unilaterally to resolve that.
Yeah, and thank you, Director Bika. I appreciate that. Mr. Clowns, I'll get you in just a second. I'm not sure either. I'm raising it more as a question than as a request. Mr. McComb.
There's a happy ending to this one. The legislature has already provided for civil immunity for an employer who relies on a CAPS check, unless the CAPS information is false and the employer knows that the information is false.
Thank you, Mr. Combs. Ms. Kemp.
Mr. Chair. We are going to move on to F. And so F basically says that the employer or the person conducting the check shall request the check via the online system or a hard copy form that we've developed. And so this is to address the issue of speed. We very much intend to create a simplified online mechanism for employers to request the check and to provide that information back to them electronically so that we can expedite the process. We wouldn't be getting a bunch of letters in the mail every day, unfolding those and then sending letters back out. However, we did acknowledge that there may be some people who don't have access to a computer to do that, and so we've allowed for a hard copy form to be utilized to request the check as well. Okay, moving on. We're at the discussion point part. So I'm going to outline G, and I'm going to talk to you a little bit about sort of some of the items in here that we know have been pain points and discussion points for employers during our stakeholder meetings. But G outlines the requirements for the fee for the CAPS check. And so number 1 talks about that the fee is specifically to allow the department adequate resources for the direct and indirect costs for the appeals process, which we discussed last month, and then also to conduct these checks. And we propose that the fee be no greater than $35 per check in rule, unless the state board approves an increased fee, and that we would post the CAPS check fee to a website so individuals would know that, and that gives us, we propose to give us the ability to adjust the fee with 30 days notice. So I'm going to stop there and talk a little bit about the reasoning behind our suggesting $35. We understand that that is a lot, that is a high cap, and that will be difficult for employers. The fiscal note for House Bill 1284 essentially assumed a $16.50 CAPS check fee. That's based on various assumptions and calculations, as you can imagine, to come up with a proposed estimate of $16.50 per check. We don't at this time have any reason to believe that the fee would be as high as $35 at any point in time. However, we have looked at various scenarios that if this were to roll out differently than we're expecting, could potentially drive a need for a higher fee. And so essentially what the statute did was it said that this body, the state board, establishes a max fee in rule, and then the department has the ability to set the fee at anything below that, and that we are required to, we would need to establish a fee that allows us to pay for the due process and the CAPS check costs. But it doesn't allow us to build other things into that cost, right? It's very specific for those costs. And so we've looked at various scenarios. One of them that I wanted to mention to you today is in the event that the appeals, the number of appeals for some reason is double what we're anticipating. So the fiscal note assumed 20% of substantiated perpetrators in a given year would appeal, and about 25% of those would potentially involve the Department of Law. And so if for some reason those numbers were double and 40% of substantiated perpetrators appealed and 50% of those were involving the Department of Law, the legal costs for the appeals process would be significantly higher, which would drive a fee of closer to $30 per check. Again, I want to reiterate that we don't anticipate that happening, but until this rolls out, we really have no way of knowing. And you might ask where we based the 20% and 25% on for the fiscal note. And that was essentially looking at the appeal process in child welfare, since they have established due process. And they had somewhere between 10 and 20% of people with findings appealing. And again, closer to 20% of those involving Department of Law. So we feel like our estimates are on track, but we also are proposing to add some flexibility in here to ensure that we are able to be in compliance.
Dr. Core. So then what's your estimate of the real number under normal conditions? Is it below 1650?
Okay.
Thank you, Mr. Chair. So at this time, we are estimating it would be very similar to what is in the fiscal note. I would say, it could range from $15 to $20. However, like I mentioned, in a drastic scenario like double the number of appeals, that would be higher.
Dr. Corfalo.
So I know this is a point of concern.
Mm-hmm.
When you set a high rate, your first bailout point is to raise it without looking internally to see what other solutions there are. Sort of like when we raise sales tax by 2 cents, and when it sunshines, we find another purpose for it. And so it's just what we do in government, I think. And so I would rather see us set it low, and then if it's the last resort, bring it back to the board. Because I think you're going to go to that 35 pretty quick.
Mr. Chair. I agree that's a valid point, and I think the scenario that I'm sort of referencing is we have no control over who appeals because that's the opportunity that they have. So that is not a cost that we would be able to control. However, it is one that would significantly affect the fee. But we would absolutely look internally if there are efficiencies that we can make on the CAPS check side to make that process that is somewhat within our control. So that's an area that we can continue to monitor and make sure that we're being as efficient as possible. It's really the appeals process that we have no kind of control over.
Director Bika.
Thank you. I just want to share with the board also, there are limits, statutory limits of for these cash funds about how much the department can have beyond the actual cost of operations. So if let's say we rose the rate to $25 or $30 and our costs were less than that and we started to bank up money, we would be required by law to drop that because we cannot have more than, forgive me, I can't remember what the exact limit is, but there's a limit about how much you can have in those accounts before you have to drop the cost. And I've seen in other program areas where you might have a rate that's typically 25, but because you've come up with so much money, you drop it down to literally $5 or something for a period of time so that you can spend down what you've built up. And it's a balancing act of trying to manage all of those. And that's the other reason that program is suggesting that we set a max and allow the department to manage within those resources based upon needs, cost, and the statutory limits to not exceed capped amount.
Ms. Taichung.
You answered part of my question, but when you say you're gonna be, like, who manages that up and down and how often is it looked up on for budget to say, oh wow, this is where we are?
Ms. Kemp.
Thank you, Mr. Chair. I believe that responsibility would fall within my division, and we would, particularly in the beginning, be monitoring that very closely to ensure that we're not in either situation charging too much or too little. And the reference that Director Bika made, it's actually section 2475402 in statute, and it's a max reserve fund from year to year of 16.5% over the prior year's costs.
Ms. Taichung, follow up.
So when you say the no greater than 35, so does it start at there, or are you saying, like, who decides when those numbers change?
Ms. Kemp.
Thank you, Mr. Chair. So we will at CDHS be reviewing our costs for both the appeals and the CAPS check that are part of the fee, and so we'll be monitoring those regularly. And so we would decide if for some reason it was getting to be close to the end of the fiscal year, for example, and we identified a situation where we had excess funds, we would lower the fee with the 30 days notice that's proposed, or raise it if it was necessary.
Mr. Busher.
I'm not sure I heard the answer to what I thought you were asking. Where are you going to send it?
Ms. Kemp.
Thank you, Mr. Chair. So we haven't established a specific dollar amount. We want the rules to pass first. We wouldn't want to be talking to stakeholders about a dollar amount that you didn't approve a maximum to cover. It's based on everything we've reviewed at this point. We don't think that it would be much different than the $1,650 that was proposed. That feels like a reasonable place to start based on the assumptions and calculations that were both in the fiscal note and that we've been doing over the years since then.
Mr. Busher, follow up, please.
I appreciate that answer. I would be inclined, and unfortunately I'm not going to be here in June when the final vote, but I would be inclined to set the rate now at $1,650, knowing that it only takes 2 or 3 months if we have to come in and make an adjustment through the board process.
Ms. Kemp.
Thank you, Mr. Chair. I'm not sure what the response is from Director Bika, but I do know that when we propose rules, rule changes, typically we do allow those stakeholder feedback time and things like that. So that's always a challenge to come to the board. I know for this particular rule packet, we started a year ago. And I know something like that would be more of an emergency situation, but I still don't know the time frame of how long it would take for us to come back to state board to get that change approved.
Sure. Director Bika.
Thanks, Mindy. The $35, do we have this replicated anywhere else in the department, this scenario and this amount that you're referencing?
Ms. Kemp?
Thank you, Mr. Chair. Yes, it is the max fee in the child welfare process.
Director Bika?
And so we already have a background check that the board's already approved for doing child welfare background checks, and you copied their language and their amount for the maximum fee there, correct? Okay. I just think that's a helpful, Mr. Chair, a helpful equation. If you lower it to a lower amount to manage this, which I sense some board members are wanting to do, you're setting a completely different approach than the one that you've approved to do the same system in a different context for different employers for a different population, this being kids in the child welfare system.
Is Mr. Bush a follow-up?
Yes, I understand that if I followed that correctly, that there is similar language in the child welfare rule and statute. What is the rate set in child welfare?
Ms. Kemp, can you speak to that?
Thank you, Mr. Chair. I don't have exact numbers off the top of my head, but I can tell you that theirs has varied over the past couple of years. And so we can get that information for you.
Ms. Brewer, did you have a question?
To you in a few moments.
Thank you, Mr. Chair. I think Mr. Busher and I are kind of on the same page. I have a concern with having more than double the amount of fee that could be charged and that wider range. We didn't have, I don't believe we had the opportunity to set the child welfare. Maybe we did before my time, but this is new. So while I understand the need to have flexibility, more than double seems like a lot to me, but just commentary for consideration.
I appreciate that. I would be interested in understanding, to your questions, what are in fact we charging child welfare, and taking some care to noting that if we did do that in the past, it doesn't make it right, number one, and number two, to make sure that we're comparing an apple to an apple.
Exactly, that would be good to bring back to us, but is it the same magnitude? Are there the same number of background checks in child welfare that we're anticipating? I want to know everything about this before we start throwing a number out like that. So,
Mr. Wester.
Thank you, Mr. Chair. Actually, we have some information. We can share our analysis today, but we will continue to look at this. One of the points that I would make regarding this is operational flexibility of a program is important. And so what this rule does is it establishes parameters in which I am responsible and Mindy is responsible to operate the program. It sets a maximum, but absolutely we're concerned about cost as well, because I certainly resonate with the perspective of providers and the number of staff, particularly given overtime or turnover that many employers are dealing with, and the number of checks that they anticipate. And so but at the same time, it's important for us to cover our costs. And so we have an operational and fiscal responsibility as well. And so it's a dilemma. We will look at it, but we do have our analysis that we can provide via handout if you would like.
Mr. Core? Dr. Core?
And one more question, and I'm sorry, I'm going to make this so lengthy, but even with the process, I'm under the impression that a background check has to be performed each time a person goes to a different employer. I mean, is that right? I think I'd like to also understand what the process is. So even if you were looking for efficiencies within your own agency, could those efficiencies even come in the way of change of rule of how we even do this in the first place? I know we were talking, there's a rule coming up with childcare. If something comes up, does somebody get flagged? Does their record automatically get flagged when they're in employment? So, or do they have to get a background check every 5 years, or how does that all work?
Mr. Wester.
Thank you, Mr. Chair and Mr. Kaur, or Dr. Kaur. I believe that we define that later on in this rule packet in terms of, because I recall we discussed that with stakeholders at the time of kind of what is going to be the shelf life of the background check. So I'll defer to later on in the rule packet.
Okay. Yeah, sorry to jump ahead.
No problem.
Dr. Mika, excuse me.
Sorry, just want to clarify. Ms. Rogers is going to confirm what the child welfare rate is today. She shared with me as she walked out that when she checked on it a month ago, the rate was $28 for the child welfare background check. But hopefully in a few moments, we'll have whatever the rate is today. Probably hasn't changed in a month, but.
Ms. Kemp.
Thank you, Mr. Chair. I'd like to propose to the board, we do have a handout about some of our assumptions and calculations and what a worst case scenario might be with an example of the appeals process. Not sure at this time if you'd like to get into that level of detail or if you'd like us to provide this to you or if we should move on.
Thoughts? Dr. Mika?
My advice would be, we've heard the board give us, this is first reading. We'll get the answers to the questions that you have and give us a chance to reflect on the feedback that you've given us, and we can discuss it further at the next meeting would be my advice.
Can I amend that in a friendly way?
You're the chair.
Kind of intoxicated with power. Maybe it's good to share the information if you're prepared to share it anyway without getting into a deep dive into a dialogue. But to Director Bika's point, you've heard the feedback. Dr. Kaur has said he'd love to know the details, and I don't want to keep them out of our process of thinking about and ultimately making decisions about the rule packet. Mr. Busher.
Thank you. I would like to see the analysis also. It occurs to me that if one of the drivers of the variation is the appeals process, that process happens over a period of time following the initial check, obviously. And that suggests to me that we would have some time to react if we in fact are seeing more appeals than anticipated.
So I guess I would ask that it be offered to the board and just ask board members not to review it, analyze it, study it, follow up with questions, but I don't want to spend time in detailed discussion here. Director Beacon.
Mr. Chair, Ms. Rogers has returned and she has confirmed for me that the rate in child welfare is $28 as of today. And so I must say that OCAI coming in with the $16.50 preliminary rate is beating OCYF quite handedly.
Ms. Rule.
So far.
So thank you, Mr. Chair. Director Beacon, then the question I have, deeper question I have is what has that fluctuation looked like over the last handful of years? So we're really looking at going from $16 to $20 down to $17 and then up to $28. Like, is that something that's that variable in terms of a business model that it would change that much and fluctuate how often?
Typically, thank you, excuse me. Based on our experience in other cash funds, it is not as fluid as week to week the rate changes. It is generally something that programs looking at how much they have in cash reserves, what their expenses are. Our budget team is looking at that, our finance team, and collectively they're saying, where that has occurred, hey, you guys are racking up cost here, and it looks like you're projected next year, if you keep this up, to be in excess of where you need to be, you need to lower your rates so that you're not collecting so much money and burning down some of what you've put into reserve. So it's much more like a biannual, yearly process that we're having those types of conversations. But I wanted you to know that it's more than just Mindy and Mark who are looking at this. We have other parts of the department who also are evaluating these processes across the agency.
Thank you, that's helpful.
Ms. Tayed.
I don't know if you guys answered this, but why does it fluctuate so much?
Ms. Kim.
Thank you, Mr. Chair. So let me just briefly, and then you can go home and study this on your weekend if you'd like, but briefly tell you what these tables are. So the first table, and this addresses your question, I believe, is we have all of the costs identified, and scenario one is pretty much directly what was in the fiscal note. And so if you pull that up, you will see these numbers. The fiscal note did estimate 44,000 checks a year with dividing the total cost equals a $16.55 per check fee. That's where that number comes from. Scenario two, we've just updated it slightly because we actually went back and looked, and we think that, again, we have no way to tell how many requests for checks will come in starting January 1st, but we actually think it might be closer to 55,000 checks. And then we did add some additional legal fees because we're seeing more people substantiated in a year in APS, and our original estimates were around 900 people a year, and we think it might be more like 1,200. So when you do that math, you're going to have more legal costs just by nature of what that 20% looks like. So again, the fee looks pretty good under that scenario as well at $14.45. However, and this will get to your question, is scenario three is a kind of worst case scenario. If the legal costs are significantly higher because, double the amount of people appeal than we've projected, and double the amount of those involve Department of Law, then we're talking significant costs. Those, again, are costs beyond our control for the most part, but you'll see that $1 million figure under legal services. That would result in a fee needed of about $30 to sustain that. So while the personnel and the operating costs for us to conduct the cap checks will remain relatively stable unless we have some workload issues, the legal costs are really the consideration here. And so that would potentially, and so unfortunately, we have no way of knowing what that's going to look like. Due process does start July 1st, so we will probably get a better sense of that, maybe by December timeframe of what that's looking like. But in terms of the variation, that is also something that can vary. For whatever reason, in one particular 6-month period, there could be a significant amount of legal costs that we would need to cover, and so we would need to raise the fee for that as a result of that. But then maybe the next 6 months there would be a lot less. So that's where the fluctuation would likely come from.
So I guess I just want to say, perhaps even just to hear myself say it, that what this does, and there may be precedent, maybe I'm just ignorant to other parts of state services where this is as natural as sunrise in the east. You're asking employers to pay the costs for appeals into which they have zero input. Or, which goes to another question that maybe I need to ask, maybe I don't, if an employer passes in fact along the fee to the prospective employee, you're asking the employee, in perhaps the finest form of socialism, to pay the costs that would be incurred for other employees ultimately availing themselves of their due process rights. Through the purest lens of public policy, this seems weird to me.
It happens everywhere.
I'm making a commentary. So, and I think that it represents the interests of employers across the state. So I'm not asking anyone to agree with it. I'm simply making an observation and asking that it be taken into some consideration. Ms. Kim?
Thank you, Mr. Chair. I think I've fried enough brains so far this morning, so we will move on, if that's okay with the board. Section 3 of G basically just talks about the circumstance that the employer must pay at the time of the request, and A, B, and C talk a little bit more about the method for payment, that they may use the online form when they're requesting a check online. But again, if folks choose to use a mailed-in paper form to request the check, they can mail a check to us. And then C is related to that they may request that the applicant reimburse the employer, and that is, again, directly from statute.
Questions? Is there anything in that section that precludes an employer requiring that the prospective employee pay the fee? Ms. Kim?
Mr. Chair, no, there is not.
Okay, thank you.
Moving on to H, this is another one that we wanted to have a little bit more in-depth discussion with you all about in terms of our proposal. We are proposing that the department have 10 days to respond to the request for a CAPS check. That is the allowance in statute for this. So statute did identify 10 days for the department to provide the response. We have received, obviously, concern from stakeholders that that is a long time to wait for the response to this check. We do not at this time anticipate that it would take 10 days. In fact, we think that we can build a system and a structure efficient enough to respond to them within 2 to 3 days. However, we did want to allow some flexibility and rule for any, again, varying situations, since we've never done this before and we actually don't have a system up and running currently that we have in our division and office to compare this to that functions in this way. If for some reason after, say, a holiday period or something, we received 5 times as many checks as we do in a typical week, there may be a situation where the checks would take longer.
Dr. Kaur?
So if you don't think it's going to take 10 days, I'm just saying human nature is to take whatever time you're allotted. And so could you say you're given 3 days, and if you have to go longer than that, then you've got to fill out a piece of paper, put some burden on the person that needs to go longer?
Ms. Kim?
Thank you, Mr. Chair. We will defer to the board to establish the time frame, so whatever you feel is reasonable. Again, this does mirror the 10-day time frame for the trails checks that are in child welfare, so we use that as a starting base. I can tell you that Peg Rogers and I are very much interested in efficiency, and throughout the stakeholder meetings, I heard their concerns loud and clear on this issue, and so we would take it very seriously.
Ms. Tiny Channel?
So on the stakeholders' comments, was there any date suggested?
Ms. Kim?
Sorry.
You're fine.
As how long they wanted?
Ms. Kim?
So you will probably hear from stakeholders later, so they're welcome to share with you any proposals that they have. But my impression was obviously employers would like to check return to them as soon as possible.
Mr. Busher?
Could you describe how the system is going to work? Is this filling out online the data about the prospective employee and it automatically then going through your system to a database, or is there going to have to be a human interaction which slows down the process? I'm familiar with some of these checks in which there is no human interaction and it only pops out if there is a problem detected.
Ms. Kim?
Thank you, Mr. Chair. You've touched on an issue that stakeholders have suggested that we use an automated system for these checks, and what we are proposing to you and internally working on is a system that would allow a human element, to require a human element to this. So essentially, The way that we're looking to structure it is, again, similar to the way the checks are conducted of the trails checks, in which information would be provided, whether it's online or via paper form, to us on the person that the employer is checking. So name, date of birth, some basic information on that. We would actually have a staff person on the 10th floor here that would go into our CAPS database directly and search for that person with the various information. We would also have a protocol and a sort of quality assurance mechanism to ensure they maybe check different spellings of names or try different scenarios to ensure that they did as complete and accurate a check as possible. And then there would be a system where in the majority of the cases, there will be no match or no hit. They would basically click a button and an automatic response would go back to that employer. So we don't anticipate it being a very time-consuming process, but it is different than you were enter a name and the system would actually spit back a result.
Mr. Bush, your follow-up?
Can you give me your thinking about why that sounds to me a little bit like we are taking the responsibility for errors that the employer might be making when I could also, and I understand that, I don't disagree with that, but I could also see it's their responsibility to get it right. And just curious, what's your analysis?
Ms. Kim? Mr. Wester?
Thank you, Mr. Chair. Mr. Busher, thank you for that. You're exactly right. We are very sensitive to the accountability that comes with this. I want to kind of step back and kind of start with your first question and say something about the process. Please keep in mind that the people that are who are in the CAPS system, and even the smaller subset of people who have been substantiated for abuse and neglect in the CAPS system, that's the only place that information resides. Assuming, well, for the exception of a criminal case that was tried and the person was convicted of criminal abuse and neglect, okay? There are many more people because so few cases are convicted and documented by the county clerk and then it shows up in like a database like cohorts or something like that. There's going to be people who are substantiated for abuse and neglect in the CAPS system. So that's the primary function of the APS CAPS system. Within that, when we have a name that comes to us, let's say a name like Brian or Chris, there are multiple variations of how to spell Brian or Chris. Chris may be female, Chris may be male. And that's why, and we've looked at this, we would love a system that was automatic and you could access it and instantly get back a name, right? But one of the challenges to that, building a system where there's a unique identifier, you might recall in Rule Packet 2, we took out any Social Security number or private information like that, which is by definition a unique identifier. If that were the case, if we had Social Security numbers for every person in CAPS and the employer could plug in their Social Security number, then you could have an instant check because you would assume that was correct. So as a result, because we're dealing with the intricacies of getting it right, and I would also point out that, yes, we are taking the accountability as a department to get this right. Because if I harm someone in a care environment and then I go to another care environment and something terrible happens, and let's say the department, the employer got it wrong. Well, because we own the APS background check process, the CAPS background check, the department's going to be held accountable either way. even if it was the employer that made the mistake.
Dialogue, please.
I appreciate that, and that's a really good analysis, and I've been trying to think through,
Right.
you know,
Absolutely.
our number one responsibility is protecting vulnerable populations.
Sure.
That's right. So I'm with you. How much of this is based on social security number and not the variations in the spelling of the name, Chris?
Thank you, Mr. Chair. Let me take an attempt at that. I might be misunderstanding your question, but you might recall that we do not collect social security numbers. We took that out of Rule Packet 2 back in March, I believe, and April when we, actually it was February that we did the first reading. And we took out any unique identifier because the board was concerned, and rightfully so, about privacy. And at that point, so now what we're relying on is name and address and other identifying information that the employer will supply us.
You're telling us that the unintended consequences of our prior decisions may not always be as good as we know.
Isn't that true for the department as well and for us?
Yes.
Well, what happens with fingerprints? Is there a mishap in that? Because that is a very unique identifier.
Mr. Wester, Ms. Kemp, who wants to take a shot at that?
I'll respond to that. Well, thank you, Mr. Chair. We don't currently collect fingerprints on people that are suspected of abuse and neglect. Fingerprints, I think the FBI uses fingerprints, CBI as well, but we have no way of collecting fingerprints in the background checks process.
Just add a footnote to Mr. Wester's testimony that even when you have a unique identifier like social security number, like for example, some states require social security number for voting registration, even then you have so many matching issues that, you know, in a voting rights case, we actually had an expert testify about faulty matching in the voter registration database because it's certainly nowhere near the point where we could trust a machine to automate it. The questions are that fraught. The other issue is if we're going to have settlements that conditionally expunge APS findings, that will need a human being to look up to see whether those have been fulfilled. So a typical settlement condition is, expunged until this date. If there are no new findings, that at this point we don't have, or neither Trails nor CAPS can automate that kind of settlement, so that we could just plug and play.
Okay.
Mr. Chair, I appreciate the questions and the dialogue around this. I did want to touch on a few other factors related to the 10-day turnaround and specifically the process that we're intending to use to conduct the checks. As Mark mentioned, our main concern with considering any consideration of some sort of automated system would be for what we refer to as false positives and false negatives. And so we feel like that human element, while we don't anticipate it would be terribly time consuming, is necessary to ensure that the information that the employer provides, that an appropriate and effective search of the CAPS database is done based on that information, and that the information provided back to the employer on whether or not there was a hit, reduces any possibility for a false positive or a false negative, and that we could provide as accurate and reliable results as possible. So in the instance of an automated check, if you were to, for example, enter in John Smith and it was just going to spit back any results with that particular name, you could potentially end up with a false positive in that we have 5 John Smiths substantiated in the APS database. So you would get all 5, as opposed to the one in particular that you're actually looking to hire, which is where we start to run into confidentiality issues, because it's really not our place to be providing all of those John Smiths back to the employer. And then, of course, the false negative would be a situation where the employer just entered one spelling of a name, John Smith, and it's really in our database as Jonathan Smith. So that would not generate a hit, and they would get a letter back saying that person is not in our system, when in fact they truly are. And so what we've talked about internally, and we've worked on this in our discussions and thoughts about how we would design the addition to the CAPS system to add this functionality, is that we would actually have some sort of standard protocol for our staff that do those checks to make sure that they're entering different name spellings and things like that to make sure. And then they would actually have the ability, since they would have authorization to be in the CAP system, if for some reason something looked weird, they could even go into the case notes and say, to verify some information, whereas that wouldn't be able to be used, in an automated check. So that's our main concern on this issue, and why we feel like, again, getting back to the 10 days and how this relates to that, it will add a little bit more time than an instantaneous check, but our goal is to be as speedy and accurate as possible. And until we get up and running, it will be difficult to tell exactly what the turnaround time is like.
Mr. Bushy.
Would this be easier if we had not made the decision on social security numbers?
Ms. Kim?
Thank you, Mr. Chair. I don't think that would actually have made much of a difference, because the language we had proposed in that rule packet was actually for the caseworker to request the social security number if available. So it was not actually adding a requirement to rule that a substantiated perpetrator was required to provide it to us, and so they would still have the option not to, which of course many of them would choose. And so there currently is no statutory requirement for somebody substantiated in an APS case to provide a social security number. So there's no way that we can require somebody on the APS side to give us their social security number. So even if the employers were able to give us the social security number, we don't have a number. We can certainly have a field for that and have it available if it exists as one of the data points to match on, but we can't rely on that always being there.
Please proceed, Ms. Kim.
Thank you, Mr. Chair. So under H, we also talk a little bit about the method of providing the CAPS check results. And that if, again, statute allows for a person or entity to conduct a background check company to conduct the checks. So we're just saying in number 2 that they must provide those results to the employer to clarify that. And then I talks about that the items that the CAPS check result would indicate to the employer. So it would obviously identify whether or not there was a substantiated finding for mistreatment on the employee that they're requesting the check for. It will indicate the purpose for which the information in CAPS will be used. So it will be clear language about referencing that they cannot share this information with others. And then the consequences for if they do improperly release the information. And finally, for those in which there is a substantiated finding, the results will include the date of the report, the county department that did the investigation, and the type of mistreatment and the severity level. Are there any questions on that before I move on? Seeing none, I will talk a little bit about J. So the statute required us to look into whether we can do what we've called a flagged check. Essentially what that is once the employer has submitted the initial request for a check, the legislation asks that we look into the possibility of whether if that person was substantiated in a case of mistreatment and APS following that, would we have the ability in our system to flag that and then generate a response to, at that point, let the employer know, you requested a check January 1st, it's now March 1st, this person has been substantiated, and then for us to notify. So we did look into that, and we are able to do that type of flagged check. This is something that employers, I think, have expressed an interest in, because not only do they want to know the check as of the date they hire the person, but also in the future. So that's what J talks about. So that information will be provided. And then kind of concluding K, we've noted here that the findings shall not include, be included in the CAPS check results when. The finding was made prior to the July 1st start of due process, which you all approved last month. The finding was expunged as a result of a successful appeal. The substantiated perpetrator was age 9 or younger. And we are requiring that a positive match of at least 2 data points occur, such as name, date of birth, address, that sort of thing, because we don't want to, again, provide a result on a John Smith that isn't the correct John Smith. I will pause there for questions.
Questions, Commissioner Johnson?
Thank you, Mr. Chairman. So in J, your duty to notify an updated record in CAPS to an employer who made a inquiry prior to that update. How long, I don't see a time limit in there. So this seems to imply to me that you have a duty forever to go back and notify somebody 10 years later, and the employee may not even work there anymore. So are you setting yourself up to have to keep track of these people forever?
Okay.
Thank you, Mr. Chair. Yes, that's a good question, and something we considered and talked to stakeholders about as well. We had initially proposed language in here that basically said that the employer would have the obligation to let us know when that person no longer works there, but that wasn't a very good solution to that issue. And we realized quickly that that wasn't a practical solution to address that issue. However, we have discussed internally that we would have a process, and we don't anticipate that there will be many of these flag checks that come up, right? I mean, maybe 10 a week, that we would identify a process internally to reach back out to that employer to say, does this person still work there? Now, obviously, they can say yes or no, accurate or not, but just to confirm that we're not providing information to an employer that actually that person no longer works for. But in terms of the sustainability over time, we really don't anticipate it being a problem for our system to maintain both a record of who requested what check on who indefinitely, and also, of course, the substantiated findings.
Follow up, please.
Secondly, I think you mentioned you had a printed copy of the legislation. Can I see that?
Other questions for Ms. Conduct Corp?
Just generally, so I get an understanding how this works. Can an employer screen to a certain point without ordering the CAPS check? So,
I'm sorry.
does that make sense? So can you say that again? So does an employer screen to a certain point before ordering the CAPS check, so they screen people out? And do some do that better than others? So do we get a system full of appeals because maybe an employer orders a CAPS check on everybody that comes through the door?
Ms. Kemp?
Mr. Chair, there's 2 kind of pieces to the answer to that question. First is that the appeals process will actually happen prior to the CAPS check. So if you think about it, once the person is substantiated in an APS case, then they have their appeal rights, and that is the process that will start after that if they choose. Independent of that is the CAPS check. So if that person a year later were to go apply for a job at a nursing home, for example, and their employer would request the CAPS check, then the appeal process would already have been underway, and the result from CAPS would either say, so the appeal process is actually independent of the check. That's one piece. And then in terms of what was your second, it was the time frame for hiring. The only requirement in the statute is that they request the check from us for CAPS prior to hiring the person. And so they can do that at any point. and they don't actually have to wait to receive the results before hiring. Now, many employers have obviously said we will wait to receive the results, but they could potentially do something like a conditional offer or something like that, or start them in training as they're awaiting the response.
Unless there are pressing questions now, and unless you've got anything else you need us to hear now, Ms. Wester.
Yeah, Mr. Chair, I was just thinking about the issues that we've talked about relative to the cost, the speed, and the quality. And as a program and as a new process within the state, we're trying to balance all of those. And you might have heard the concept of speed, cost, and quality, or high speed, low cost, high quality. Which two do you want, right? And I would suggest we're trying to balance all of that, because there are competing demands and there's competing constraints. Obviously, we want to get the people, we want to be dead on in terms of saying, yes, this person has harmed a vulnerable adult previously, or no, they haven't. We want to nail the quality. Speed and cost, we're sensitive to that too, because we've heard, absolutely, I've been in the position of waiting for background checks from CBI or from FBI or county clerks, right? And I know what it's like to give conditional offers and wait. But we're sensitive to the speed as well, and then balancing the cost. And that's, I just want to underscore that, and we're very sensitive to that. I appreciate the dialogue that we've had relative to this first reading.
Ms. Dichano.
And I appreciate your honesty and thoughtfulness in this process. I know it's complex.